Welcome to our Benita's maternity program, Antenatal class. Today we're speaking with Sister Talia about the importance of antenatal massaging. Welcome, Sister Talia.
Hi everyone, thank you. Yes, today we'll be speaking about the importance of antenatal massage and what is it all about. We've heard a lot about it and we don't always know. So basically, the antenatal massage on its own, it entails massaging which aids reducing fluids that build up in the joints, around the soft tissues. And what it does, those fluids that kind of obtain in there, it does cause a lot of inflammation, etc. So what do? The massage actually lessens that, the stiffness of the joint. It relaxes the muscle as well as the soft tissue surrounding it, and it relieves the discomfort, which is a big part of, especially towards the end and the mid of pregnancy, and it lessens swelling. So it lifts one's spirits. I mean, if you don't have pain, you feel much better, more relaxed. And also, some people have a lot of despair and anxiety associated with pregnancy, so it actually does lift in that way as well. So, when is it dangerous? So, the word dangerous is quite a far-fetched word, but a lot of times we've heard shouldn't have massages, and that's true. It should be by a trained professional that is trained in pregnancy massage. It's completely different to your normal aromatherapy, these little cups they put on, or Swedish massages, but these should be done by a trained professional. So, it can be dangerous if there's a clot or bone fracture. So some moms have lower or less circulation, blood circulation in the body. Then I always say, let your doctor approve it for you to have a massage. Skin conditions is quite a big thing. Some people have quite a aggravated skin, so certain oils used can aggravate the skin. Conditions such as eczema, open wounds, infections, and even skin burns. And your skin can burn due to massage or certain oils used that's sensitive. So sensitive skin, please let your massage therapist, in any case, know so that they can know which oils to use. Your doctor would be the first point of call before making this prenatal booking. So, what oils can I use? Okay, so we have a lot of oils on our list, and some oils can cause big rashes like severe bulbs, red bulbs, skin hives, etc. Oil, Orgeona, jasmine oil, cinnamon bark oil, lemongrass. Oh, it smells so nice, but it like leaves a very nasty rash on your body sometimes. Chamomile oil, bergamot oil, great for the hair, bergamot oil, nice and long hair, but terrible on the skin. It causes a lot of reaction. Ylang oil, relaxing, but again, it's not the best oil for pregnancy time. And then we have some other oils available. So I usually say lavender is your friend, but less is more. It can be overwhelming, especially towards your respiratory system if you have all these oils coming on and going on your system. So I usually say rather avoid those ones. And lavender oil is good for relaxing, but less is always more. Okay. When we come also to the rest of the oils, a lot of people don't just have a reaction for skin, they have a respiratory reaction, which is quite a big deal, and it can cause a lot of discomfort. It can even cause hospitalization. So be very careful if you're sensitive to aromatherapy things and the smell of it. So massage with lavender is great. But avoid it even that if you have a sensitivity to it. Less is always more, as I mentioned, can also calm you down very well. I love the natural thing of lavender. So I have this little lavender tree at home, and when my kids and us all are going through exam or very stressful times, I take a little leaf out of it and I put it on the pillow of each one of us, and it just somehow soaks through and it gives you that natural kind of relief. So it does do its trick, especially in stressful times. So I always say, if you had a previous miscarriage, it's best to avoid oils. It can have the potential to lead to miscarriage. It's not the only reason. Remember, there's always underlying health issues, but that's one of it. And even bleeding, vaginal bleeding problems, epileptic, heart disease, thyroid, and liver. Those are a big, big deal. Diabetic problems, those are people that usually avoid all essential things. Homeopathic things should also be prescribed if you have any of those conditions. And then antibiotics, if you're currently on it, antihistamines, the oil actually affects the working of the drugs. Because we must remember in oil, there's healing properties, there's health properties. And in that oil, there's also a type of functionality in there that acts as a medication. So whatever else you take medication, it actually buffers it around. Okay. So when should I have it? So this is a topic I can actually speak all day about because it is so broad and there's so lack of knowledge in it because a lot of times I know I was pregnant, then you're given gifts for massages. You get to the therapist, they massage you, and a few hours later, you just feel so sore. So I always tell moms towards in the first trimester, I would avoid massages, especially if you have a history of miscarriages, history of vaginal bleeding, history of certain things that have brought on early labor. Avoid it. Second trimester, yeah, by 25 weeks, body gets heavy. Everything feels heavy. Joints feel sore. Now it's the time to book. So what do? I book with my massage therapy, a trained one and a professional one. So I check on their credentials as well. Once I've booked, I first check with my doctor if I have any underlying health conditions. Doctor has cleared me. I get a real therapist or a correct therapist for me in my area. And there we go. So, what is the first thing? I will tell them what is no-go zones. If it is a registered therapist with pregnant mommies, they will know what to do. Okay. And they usually won't tell you come anywhere before 27 weeks. If they take you at 25 weeks, it would be light massages. It would be more if you are really overwhelmed at work. Maybe you've been experiencing in the first trimester severe nausea. You just need some lifting of spirits, as we call it. I've seen the benefits of prenatal massage on moms, on anxiety conditions, as well as even on the birth happening later on. I've seen how moms just open up beautifully in labor. They come with this relaxation, just a glow about them. And I do believe in the healing power of touch. We can never forget that touch connects touch. And ultimately, your baby is within you. The baby is touching you. Okay, and you touching baby. And by you relaxing, the whole being of that baby changes. So when baby is born, the environment he comes into is completely different to this warm, safe environment. He's seeing this very relaxed mommy. She's tired of laboring for 12 hours, but she's got that comfort, that good hormones running through her. So I always say 27 weeks and up. It's a good time to go if 25 weeks, especially moms that has conditions of severe swelling. Edema, we call it medically, but it's swelling. That could be very beneficial to them. And about twice every month, not weekly, not daily, twice every month. Because remember, they will switch it up the sessions closer to the birth. Make it maybe less, maybe more. So what should I go? Okay, so first of all, there's going to be a lot of exposed skin everywhere. So make sure you're comfortable, good old-fashioned cotton undies, a tank top if you have one. If you're not comfortable, initially undressing, they can always work around the tank top. But what they do is you will possibly take off your top, just have your panties on, good old-fashioned cotton panties, and they will put a towel over you. It's very relaxed, closed off, so nobody could see you. It's just between you and your therapist, massage therapist. And what they will do is they will actually let you know what is happening. Okay. So for moms in their first trimester, you need a doctor's note to say you are safe to go. Remember the conditions I mentioned earlier, such as previous miscarriages, etc. That may be a reason for a doctor not to give you approval, but if not, you would get it. Position. So there's various positions, and why I put this in, I know if it is a proper massage therapist, they will tell you, but moms are just laying on their tummy because they see it in the movies. If you are a certain amount of weeks over, like 27 weeks, it's uncomfortable. So I would say rather left side. Remember, left is best, lots of oxygen to baby. Oxygen is the best because of that blood flow being so great. So left side would be my preferred side. A little bit on the right as well. If they get this side again, massaging, you turn to the other side. That will improve oxygenation because baby safety is still something we need to consider in all of this. Okay, and some moms love laying on their stomach throughout their 9 months, and that is just their comfort spot, you know. So if you are comfortable, maybe place some pillows before you lay flat down, just to give it a bit, maybe 2 pillows at the bottom of the tummy, pelvic area, 2 pillows on top. And then hydration. So make sure you drink enough fluids before and as well as you're going to your as you are at your massage therapist. So at every phase of gestation, you must feel comfortable with this therapist in your position you're laying. Remember, bigger press, laying face down is uncomfortable. You will also notice that some therapists have wedges they put in between you. It's not because they think you're an elephant laying there, and we don't even judge bodies. You know, every pregnant body is beautiful because there's life carrying inside there. And we also customize certain things. So the hollows of the face hollow that you usually get with the massage is sometimes different when it's a pregnancy massage. I really do hope you guys enjoyed this antenatal class. Like I said, I can go on forever about massages, but I just want you guys to get all the facts straight. First of all, we need to get permission from our GP or doctor or a gynecologist, basically, or midwife if you're following that route, to make sure that it's safe for our pregnancy, not a friend's pregnancy or a neighbor's. We need to make sure that our condition allows it and it would be safe and beneficial. Secondly, a correct and registered therapist. You can figure it out once you get there, but then you are standing there, you have to maybe pay a bill. The other thing is to just make sure that if you have chosen a corrected therapist and you get there, first of all, check what position they're telling you to lay. Face down on your tummy. I mean, that's so uncomfortable, and they don't even offer wedges or a pillow. You already know maybe I'm not at the right place. You should ask them as well, what oils will you be using? If they're saying ylang, you know this is incorrect because that oils is not, it's going to cause the miscarriage or effect on baby or yourself, including yourself with skin reaction. So please, moms, just be careful, enjoy it. Take in that few minutes to yourself. This is part of me time. And I often say to moms that had babies as well, don't forget the power of touch. It's even more important than the pressure of the massage. A touch causes endorphins to rise, so the good hormones in our body, the oxytocin, the love hormone, like the one we have for our newborn when we hold them in our arms. So it causes it to rise, and it takes all that bad anxiety, fear, depression, oftentimes the fear of giving birth or the fear after birth, and even the fear of having a new baby and the overwhelmingness of not sleeping. It brings it down completely because that oxytocin is rising. So you need some time for yourself. If you have your new baby, take one day or afternoon to a trained therapist as well, and go and have that massage. Take a break from Baba as well. It's only for an hour. And baby will be fine. You come back to baby and you'll be the best mommy because you're coming from a place that you've rediscovered again yourself. Okay? So remember, that's very important, including in pregnancy. Take time off and please don't book anything for that day. If you go, don't drive. That's another point I forgot to mention to you, moms. Do not drive because oftentimes after this massage, it's a sudden flow of blood and oxygen to the body. And if you're just driving around afterwards or you go up and down on your own, it's different if somebody's driving you. You can get dizzy as well because your head will spin a bit. It's a new blood flow now suddenly towards your legs, your arms, your body. So please take it easy for the rest of the day. Make sure you take a little light snack beforehand and make sure you do eat something after as well. But enjoy it. And if there's any concerns, please drop a comment below and just let us know if there's anything else regarding massage, particularly you would like to know or that you are worried about.